today, many people are looking for integrative health practitioners. So I'm going to make it easy to be able to identify one. My name is Dr. Erica Steele. I'm a holistic doctor in family practice. I hold 6 degrees in my field, and they're all in the natural healthcare space, ranging from psychology to natural healthcare sciences, alternative medicine, natural medicine, public health, and I'm a board certified naturopathic doctor. Hundreds of certifications, which I won't get into. Okay, so how do you identify an integrative health practitioner? Okay, so first things first, you want to check their education. So where did they go to school? What's their primary education? Are they a medical doctor? Are they an osteopath? Are they a chiropractor? Are they a naturopath? Are they a naturopathic medical doctor? What is their original base training? That's going to help you understand kind of where they're coming from in the beginning. Like I've said in other videos, allopaths have a little bit of a difficult climb, in my opinion, coming from that baseline training that they learn the body's kind of separate to learning that the body's integrated. So, that's fine if they have that initial baseline training, but they're definitely going to want to have additional certifications on top of that to be able to learn. And also those certifications need to be more of natural health modalities. So let's say acupuncture or homeopathy or herbology or functional medicine or integrative medicine, some of those types of trainings to help them to really understand how this body works together as a team, because they're taught in their initial program that the body is not a team. It's isolated like little islands. You've got the heart over here, you've got the digestive system over here, you've got the bloodstream over here. And so teaching them that it's a whole sometimes can be a bit of a challenge. And so there's that. If the provider is a chiropractor, then again, they're going to need that additional training because they're taught that the spine has the subluxations in it, which can interfere with the nerve function, which then impacts all kinds of things. So their baseline training is really about adjusting on a physical level. And so now we're looking at deeper mental, emotional, physical imbalances, detoxification, nutrition. So we want to make sure that they have some additional education in those areas of specialty as well. Same thing goes for like physical therapists as well. The other thing with acupuncturists is they're going to need to have that Western medical training because their training traditionally is going to be more Eastern. They're trained in the bioenergetics of the human, not necessarily in the biochemistry. And so integrative health, they really need the biochemistry. So just some things to consider in terms of their baseline training. I'm a naturopath, so we are definitely trained all in nutrition, detoxification, mind-body components, emotional components. We're trained holistically. And then I went off into psychology and various different aspects of psychology and trauma healing and all of those aspects, as well as in integrative healthcare to understand how I integrate with allopathic doctors and functional medicine and being really skilled in functional medicine and homeopathy and all different modalities. So I've done a lot of training in a lot of areas to really be able to I have a big toolbox to be able to offer my patients. Here's a way to identify a good provider for you. So are they open-minded? That's really important. So even if they don't understand it, even if they don't agree, there are patients that come in and they talk about, I want to do an alkaline diet. I don't agree with an alkaline diet. I'm not opposed to it, but I subscribe to macros, your proteins, fats, and carbohydrates. However, I'm open-minded enough to educate that patient and meet that patient where they're at. Are they willing to listen? Number 2, are they willing to listen? So they need to make sure that they can listen to the patient, even if they don't agree, and also be able to be actively listening to hear what's going on with the individual. Are they willing to be open to the patient and to the discovery? So are they willing to be open-minded and see where the patient's coming from and then maybe slowly lead them into a healthier direction so that they can understand what's going on? Are they also able to be creative? Are they going to think outside of the box? Or are they going to just be pretty standard? It's not just about throwing supplements at patients. That drives me bonkers when patients come in and they've been to an integrative integrative health provider who's done nothing but run a whole bunch of expensive lab tests on them and given them a whole bunch of supplements. That absolutely drives me nuts, because it's not just about supplementing. You have to address the diet. You have to address the emotional issues around the diet. You have to address what is ailing the person and their mindset. If you don't address those issues, then you're not going to gain traction with the patient. You're just going to be replacing a pharmaceutical for a nutraceutical, which just doesn't work. A supplement is there to supplement. It's there to support. It's not to do the body's work for it. It's really important that. And then, do they have various educational philosophies? I think that's really important too, because if they're truly an integrative healthcare provider, then they will have stepped outside of whatever their traditional practice is and learned other modalities to help. Because as you're actually treating patients and you're realizing that human beings are so complex, you tend to want to put different tools in your tool bag. That's how I started. I started out as a massage therapist and started working with patients, and then realized, wait a second, my people aren't getting better. So let me start looking at nutrition. And I did some certifications in NRT. And then I was like, wait a second, I just don't want to do a whole bunch of supplements with patients. And that's what got me into functional medicine. And so I just kept going back to school, getting education and deepening my understanding of natural medicine so that I could be able to really help my patients in a big way. So looking at your integrative healthcare provider, what is their baseline training, and do they have open-mindedness, willing to listen? Are they open to the patient experience and to the discovery? Are they creative? Do they think outside of the box? And what is their educational background? And lastly, this is the most important part, what's their practical application like? What are they doing on the day-to-day? If they're not actually living this holistic lifestyle, then they can't advise you on the real, because there's certain things that happen when you're trying to integrate one lifestyle into another lifestyle. So if they can't give you shortcuts and tips and tricks, etc., then they're not really living this holistic lifestyle, and they're just selling something. And so you really want somebody that you can relate to, that's on your level, that you can communicate with, and that you feel comfortable and safe with. That's ultimately, I think, number one, that you're able to open up, feel safe, and also feel heard. That's really important. So my name is Dr. Erica Steele. I'm a holistic doctor in family practice. Thank you so much for tuning in, and hopefully that helps you to find an integrative healthcare provider that works for you.